Welcome to Raising Resilient Minds. I'm Dr. Jihan, and I'm very excited to have a very close friend as a guest today. Dr. Decia Dixon is on a mission to help families achieve happiness and stability in their homes. Trained as a school psychologist, she has a unique understanding of the complex and overlapping systems where children and adolescents spend their time. In her role as a licensed child psychologist in private practice, she helps parents understand the impact of youth's experiences in both the school, community, and home setting and how it shapes their child's development. She's a highly sought after school expert and parent speaker. She also helps families by providing psychoeducational evaluations, identifying learning, emotional, and or behavioral struggles that may impede the child from being their best selves. In addition to her private practice, she consults with large school districts, has served as an adjunct faculty member in a clinical medical psychology program, served on multiple boards, and is involved in her local state psychological association and was awarded the prestigious designation of fellow by that association for her contributions to the field of psychology in the state of Georgia. She's also an active participant and leader in her son's homeschool community. So, welcome, Dr. Dixon. Thank you so much for joining me.
Thank you. Thank you. I'm glad to be here tonight. So thank you so much.
And I just love that your bio reminds everyone that our role is to help children live their best lives and be their best selves because it's so important that we remind parents of that information. So, we're going to go ahead and just kind of dive right on into a few things. But one of the questions that I love to ask all of my guests is, what does resiliency mean to you?
That's a really good question. So to me, resiliency, particularly if I think about my role, it really means to thrive, right? And it's the ability to find your place in life so that you are thriving and growing and able to, of course, face challenges, but because you're thriving, you come back again and again and again. That is, if any parent calls me, any organization calls me looking to collaborate or work together, I'm always trying to convey the message that my only goal is to figure out how to help people thrive. Right. And so,
I love it.
yeah, absolutely. So that's my definition.
I love it. And, so many people ask me, well, raising resilient minds, what does that mean? I said, well, it's a little bit different for everyone, right? And so I've been enjoying hearing, how everyone responds to that question. So as a child psychologist, right? I want, if you don't mind, because we have a very diverse audience, and I want people to better understand what you actually do. And I know I talked a little bit in your bio, but if you can just give a little brief synopsis.
Yeah. So for myself, my role is pretty specific in that I do a lot of evaluations and I also do then consultations related to that, right? So the evaluations include primarily kids are coming to me for learning concerns, meaning reading, math, spelling, writing, the gamut of school academic experiences. But they're also coming for behavioral things as well, whether it's behavioral disorders related to regulation or being able to manage like their temper, those kinds of things as well. But then I do see kids for anxiety, depression, grief kinds of things where maybe they're thinking that it is depression and really it is some more typical griefs kinds of experiences, trauma. I do see sometimes children with trauma as well. So the evaluations are a roadmap. So that's what my role is as a psychologist. And that's unique because other providers or mental health professionals can do therapy, which is something that I used to do. I no longer do. Other providers can do kind of like coaching, support kind of roles. But psychologists are unique in that they are usually the only people that are doing psychological evaluation, right? So other people may do screenings for informing for therapy, but we will do evaluations, both educational and psychological, for that roadmap for helping a person know where to go next.
Yes, I love that analogy, a roadmap, because I try to explain that to parents is that, I may screen you, but then I'm sending you for a very in depth, possibly very long,
Yeah. Yeah.
thorough evaluation so that people can tease in between different things, right? It's not an easy manner. I had a patient today, just thinking about it, who I think has learning difficulties, but there's also a question of, is there anxiety and ADHD there?
Mhm.
Well, yes, you're screening in, but if you're anxious because you have difficulty learning, and then you're fidgeting and hyper because you don't want to sit in the seat because you're anxious because you
Absolutely.
can't learn, then we have to understand what the primary diagnosis is or what the main thing is going on. And that's outside of my scope of practice. And so some of them don't quite understand. They're like, well, if you think it might be ADHD, why don't you just, and I'm like, because it's not that simple.
Yeah, absolutely. It's never that simple. Yeah. If it was, my job would be probably not really needed. So, but yeah, it's definitely not simple. In fact, I do explain to parents that children typically pretty complex. We all are, but definitely in childhood, they're complex because they're ever evolving creatures, people, right? And so it may look like one thing, but there may be something else underneath the surface, right? And children are usually not going to sit on a couch and articulate, like, these are all the things that are going on with me. Like, I'm anxious, and so I'm restless, right? Or I had a traumatic experience, and so now I cannot focus, right? So children aren't usually going to be able to articulate that because they don't have the awareness yet to be able to articulate it. They may not even know what a traumatic stressor is. They may
I mean,
say
adults don't even know.
exactly, exactly, yeah, exactly. But definitely children, right? Because of the language development and all those things that are still going on. So I always tell parents evaluations are a nice, quick way, right, to try to capture maybe what is going on and contributing to the concerns. Versus in therapy, it might be a little bit of a longer process to get to some of that. But usually with data, you can kind of quantify it a little bit easier so that hopefully then you can take it to a therapist who will continue the work.
Oh, definitely. So, in your role, for parents who may not, I'll be honest with you, most parents come to me and just think it's ADHD. They think everything's
I can believe
ADHD.
that.
And so, what signs or what are some things that you would tell parents if you're seeing some of these things, maybe you should even ask the school, for an evaluation for your child? Because often I'm seeing them when they're much older after they've already failed a class or they failed a grade.
Yeah.
And so it's not too late, of course, but it's like, could we have helped this child a lot sooner?
Absolutely. Yeah, I mean, I think the main thing always is still about impairment, right? And so there is a spectrum for impairment, right? So what you just described is definitely going to be on the more significant end of an impairment. But I do think that if you are beginning to see just even mild challenges for your child, it doesn't ever hurt to inquire, right? I get constant questions from people both at work and the community that know what I do about, like, my child, we work on these math problems and it doesn't seem to stick. Is that normal? Is that not? Well, you don't have to necessarily end up in an evaluation, but you can reach out to a provider and ask that question, right? I mean, I have lots of people that call me or come in for an intake and they are wondering if this is problematic. And then we find out, well, really, that's not too far off the developmental spectrum of appropriate. But then in other cases, people will contact me and we find out that, oh, you should come in.
Okay, no,
Mhm.
definitely. So that's, one of the things to definitely pay attention to, because one of the things that I realize is that when we talk about children thrive,
Mhm.
right, that resiliency is, if you're not given the tools early on or that assistance, then it hinders or impedes them often.
Absolutely.
So, at what age, is there any particular age, or do you just feel like parents, and as soon as you start to see it, just go ahead and ask? Or is there a particular age where you're like, you know what, at this age, I would, if you're seeing these signs, then I think that you should definitely
Mhm.
ask or reach out.
Yeah. Yeah, absolutely. So I would definitely say for an evaluation, we're looking at school age, right? So definitely I mean, because school is where the child is obviously spending the majority of their. And so if an impairment's gonna come up, that's typically where we're going to see it. There's a lot more structure there. We have the ability to have peer comparisons all of a sudden where maybe they wouldn't have had that before if they were at home. And so I think that becomes. I'll have parents that will tell me even an early school age. And when I say school age, I'm meaning like when you're beginning that school years, the first grade, the second grade, the third grade, right? I will have parents call me and say they're thinking that's too early and they should wait until they're middle school or high school. And I actually will say, I don't think that's too early because I think we know, you and I as professionals, that early intervention is the best recourse, right? We would rather be preventative than reactive, right? And so, believe it or not, although it's maybe time that's spent, or even in some cases, obviously money that is spent, it is a much better place to be as a parent when you are told, well, this isn't diagnostic at this point, but let's go ahead and get these following interventions because they're possibly at risk, right? So that's a preventative stand. Like I would rather have that kind of more public health model for mental health versus the reactive model, which is they're in crisis. And so now they're coming to me. And so I will encourage parents for that to not wait. And I would say that even when they call me and they are young, meaning that they're preschool age, they're early kindergarten age, I still tell them, even if they're not always ready for an evaluation, because some of them definitely are not, we still have a nice discussion about you can go ahead and seek intervention, right? So if you know that your child is having trouble already regulating themselves and they're 4, you don't have to say, and they're 4, so let's wait 4 more years. Right? Just guess what? They've learned a lot of not great habits around self or dysregulation, right? Not self-regulation. So I will often say, so you might not want to see me yet, but here are the following resources for
Definitely.
intervention.
And that is so, important is that I don't know, especially I see it a lot in the Black community. Oh, they're gonna get over. It'll get
Mhm.
better.
Absolutely.
And I always tell people, I'm like, it probably will. However, if we wait, then it's a much harder mountain to climb than
Absolutely.
if we would have just gotten that speech therapy or that
Mhm.
whatever those things are, right? Because again, we're creating and helping to develop these minds. And so the more, as you said, the more bad habits or the more, dysregulation, the things that aren't that aren't succinct, right? That are just being embedded into our minds is then hindering your child because then they have to deprogram.
Yeah, yeah.
And
Absolutely.
so we forget about that. Like prevention is so important. And I know that's half of my job
Mhm.
is prevention, even though they're like, "Well, they're never sick, nothing's wrong." That's not my job.
That's
My
not job.
job is to
Prevent.
be ahead of it and to
Absolutely.
ask you these things so that's why you come every year for your well checkup, right? I'm asking you how they're doing in school, but the kids will come, I haven't seen them in 2, 3 years, and they're like, "Oh, they're failing." I would have picked that up and referred them out.
Yeah, absolutely, absolutely. Yeah, and you're right because I think people want to take a very cautious approach, which I can respect with kids. If they think like, oh, I'm jumping the gun on things, but again, if you already know the concern is there, like I tell parents on the phone, it doesn't stop the concern from being there just because you wait on it, right? So it's still already there, and so instead, what I try to explain to people, very much from a passionate point, because I'm very passionate about this, which is the idea that like it's gonna probably worsen, and likely there's gonna come some other things alongside it, and so we're trying to prevent, right? So if you, for example, say, "Well, they're a little bit behind in reading. I'm not gonna get them anything yet. I'm just gonna watch and wait and see." Well, then they circle back to me, and maybe now they have anxiety thoughts. And so then now we have another secondary thing that I'm not saying we wouldn't have had before we would have treated it, but there's the possibility we wouldn't. Or we have a child with ADHD. I have a lot of those calls, right? Where they're like, even after testing, yes, thank you for that. And we're not going to do anything with the report now. We're just going to wait and see. Right. And so,
And then come to me 3 years later.
yeah. And now they come with you 3 years later and they not only have ADHD, but because of the kind of systemic way that we interact sometimes with children with ADHD, particularly the hyperactive impulsive type, they now have oppositional defiance, right? Or they're anxious or they're depressed, right? Or they have learning difficulties that I like to call, I've been using this term since I was a school psychologist, acquired learning disabilities, right? Where you were so inattentive for so long that guess what? You missed instruction. And instructional gaps now look like a learning disability because instruction doesn't stop. The expectations don't stop.
Unfortunately, a lot of our systems will just give you so much extra credit, or you can redo your test, or
Yes.
all these other things, so
Yeah.
you just get passed along. And I understand some of it. I'm not a teacher or anything. I understand some of it, but I don't think at the end of the day we realize how much we hinder our
Absolutely.
children when they don't get the assistance that they actually need when they need
Mhm.
it. You brought up a term, and I'm not sure how many people are familiar with it, but oppositional defiant disorder.
Mhm.
And so if you don't mind just elaborating
Yeah,
on it a little.
absolutely. Right. So to put that in lay terms, right, what it looks like to the lay person is that the child is just engaging in pretty significant misbehavior, right? They're argumentative, right? They're rule breaking. They're just essentially seen as annoying to peers, maybe annoying to adults, antagonizing, and right. They're just children that people say, which I don't believe in this word, but people say, "Oh, they're just such a bad child." That's, again, not true. We know the research behind oppositionality comes from typically that there are not good behavioral supports that have maybe sometimes been in place, right? That's why we know behavioral training is a really good intervention for kids with oppositional defiant disorder. It doesn't solve it all, right? But it is definitely a good intervention because we know those children really can respond better, particularly when started early, to more positivity, right? Because a lot of times that defiance can be secondary to something else, right? It can be secondary to struggles with learning, right? So I am argumentative. I am breaking rules because I am avoiding a task. And so then what happens is I don't notice the avoidance actually. I just notice the behavior. And so the response becomes more punitive. And then that child is maybe removed from the class, in succession. And so then that behavior becomes reinforced, or that child begins to believe that, this is kind of how I'm supposed to be in school or at home. Right. And so that is why, if you look at most of the literature around oppositional defiant disorder, the first line of treatment, both for home and school, are behavioral supports. Right. But again, so people will say, though, that child's very difficult or engaged in a lot of bad behavior. And, I have a heart for children. That's why I'm in this role. I don't believe that is the case. I believe that children are the leaky faucets of whatever the pipes are around them. Not to take blame on adults, right? But
Right, but yeah,
we children are reactive to what they receive, right?
no,
So
definitely. And I love that explanation. Thank that was more than what I even expected. I appreciate that because it's one of those terms that I hear thrown around a lot, and we're not actually looking at it's just making children feel bad about themselves sometimes, right? And not actually looking at the entire picture and the supports and things. And I love the fact that you touched on the fact that therapy for these children, behavioral modifications and behavioral therapies is so important. And I I can't stress enough to parents that there are different types of therapies for different types of things. And so you have to make sure that as you are looking for a therapist that you're asking and inquiring about what types of, children they're used to working with, or, what their specializations are, because they can vary. And you want to make sure that, you're able to pair your child up with the best person, which is so huge. And ODD, or oppositional defiant disorder, is one of those things that I struggle with a lot because I feel like all my patients who are in foster care get that
yeah,
diagnosis, and I'm
absolutely.
like,
Yeah.
I got pulled from their house.
Yeah. Yeah. And
Like
trauma usually. And so, yeah.
like why were they pulled from their house, right? It's so many layers to that, and I'm always looking at people like, if we're getting these diagnoses and or these labels and things like that, then we really have to step back and say, as you said, what's going on with the pipes,
Mhm.
right?
Mhm.
What is surrounding the situation, and how are we pouring into this child
Yeah.
who
Yeah.
even has this diagnosis?
Yeah.
I have a, special place in my heart for a lot of these kids because I just couldn't imagine, you know, being pulled from my parents and then people saying, "You're not acting right."
Oh, yeah, absolutely. There's a paragraph that I sometimes write in my reports for kids that are being misunderstood behaviorally to try to help adults step into their shoes a little bit. And so the sentence starts off usually with like, all children, they want to do well. Your child, if they knew how to do something different, they would do it. If they could be someone different, they would do it. I mean, children come into this world being I haven't met one, right? Even kids that are like peeing on my carpet and spitting, right? Like they want to be accepted and loved, and they want to be acknowledged. They want to be affirmed. They really do, right? They just had maybe too many opportunities where that's not happened. So if they could do differently, they would. That's my sentence I start off with. But then I also try to say, imagine you wake up one morning and your head is hurting and your back is hurting and you feel the worst you've ever felt, but yet you somehow have to show up and feed your kids. You somehow have to get them dressed. You somehow have to drive them to school. You somehow have to go to work. You somehow still have to function. Are you going to be smiling and chipper? And are you going to, if your head is really hurting, right? Are you going to be able to be engaged in strenuous mathematical problems with your kids, maybe, or do a big project with them? How available are you going to be? And what are your resources going to look? They're not going to look the same as a day when everything is filled in your cup, right? So you are still wanting to be the person that you desire to be on the inside, but you are lacking the resources in the moment because of circumstances that allow you to show up and maybe be your best self. Your children are no different.
I'm gonna give a clap on that one. She was
Yeah.
preaching to us today.
Yeah.
What I mean, that's so real.
Yeah.
It's so real. I feel like that it needs to be shared with more families
Mhm.
because I don't know why, myself is included as a parent. Sometimes we're like, well, why are you doing that? And then you're like, you know what? You're not intentionally,
It may feel
like
that way, but they're not.
they're not, and you have to, provide them with the tools that they need, which is part of why I wanted to start this podcast,
Mhm.
right? Is that I wanted people to start thinking differently and to realize that we all have a role in creating these minds, you know what I'm saying, that are going to be these healthy, hopefully,
Yeah.
mentally
Yeah.
healthy, physically adult as we go into we're breaking some of these generations of, things that are happening, right? Because we know that if you don't learn how to cope, if you are not given the tools that you need, then you're less likely to be able to give those tools to your children,
Absolutely.
right? And so therefore you create a cycle. And my goal is how do we break some of these cycles? I tell people all the time because as descendants of slaves, right, we see even though we're so far removed, how generation after generation after
Absolutely.
generation, there's some things that just did not, tools didn't get passed
Absolutely.
along, especially with learning how to handle mental health issues
Absolutely. Yeah.
and being willing to say, you know what, there's a problem. Because generation wise, we weren't allowed to, who cared if we had a
Yeah. You
problem?
just had to push through. There was no problem.
You just had to
There's a
push
problem.
through.
Mhm.
You just had to push through. And now we're in a society which our youth, they're a little different, right? They're like, "Oh, I'm gonna tell TikTok my problems." And
Yeah.
you're like, "Whoa, whoa, whoa." They're a lot more open and they're wanting to talk more.
Yeah.
And a lot of us aren't ready for that
Yeah. Yeah.
because we're like, "What are you doing? You're
Mhm.
supposed to just push through." And they're like, "Mm-mm,
Mm-mm.
that's not happening."
No.
And so it's very eye-opening to me to see how this change that happened. I don't know if it was post-COVID. I'm not sure.
Things up. Post-COVID.
Yeah.
Yeah. Yeah.
Yeah, I agree, and so it's just been interesting to see, this change in dynamics and better, equipping families to kinda see what they can do. So you talked about the evaluations and things like that you do, but I was wondering if you could just mention a little bit about the 504s, the IEPs, what the next steps are, because I don't think a lot of parents quite understand.
Yeah, absolutely. That's a very common question. So after we meet, if there is something going on for the child, that's like usually the number one question, like what's next, right? And I will be pretty honest, there's a lot of stigma around it and hesitancy about that, taking that next step. I mean, I have a lot of questions around, and again, this is no fault. This is just like, again, what you don't know, but parents wondering, like, should I even share the report? Like, even if there are significant concerns in there that are worth sharing, like, should I share this with the school? Kind of goes back to what you just said about generational situations for slavery, but there's also generational pieces with education and our relationship with education and how many families, particularly minority families, have been disenfranchised through educational systems. And so I think there is some fear around if my child has this disability or this difference. Well, first of all, that's something already that I have to mentally make a shift about. And then now you want me to share this with the school. And what is this going to mean? How is this going to stigmatize my child? Is it going to label them? Is it going to prevent them from having a future? So then that's like kind of one piece that has to have a whole conversation around that. And so I think I will address that first before I mention the 504 and IEPs, because I often have to say, well, if there is this concern, like if there's a reading concern, a behavioral concern, an emotional concern, teachers are pretty adept at like already having noticed it. Right? So there's usually not like that the teacher was shocked to get the information. Cause I mean, I work in schools, right? So there's usually not this like the teacher gets, "Well, I had no idea." First of all, if you're a good clinician, you got input from the teacher because that's what I do. So they're usually already telling me verbatim everything that was kind of already seen. They may not be giving a name to it, but they're like, this is all what's happening in my classroom, or this is what has happened for several years in this. So I always tell parents it's actually better to go ahead and share that information. Because it is one thing to think that the child is bad. It's another thing to know that it's PTSD, that it's anxiety actually, that it's ADHD, right? That it's a learning concern and there are behaviors that manifested because the learning is challenging, that there needs to be some type of intervention support around the behavior, right? So it's better to know that, if you want to call that a label, so that people can then react differently to prevent the things that we just talked. Right? So that's kind of the first thing. And then the ways to do that is through possibly a 504. A 504 is related to accommodations, right? It's surrounding civil rights and preventing discrimination for disabilities. And so it's the idea that if you are identified as a person as having a disability, we have to allow you to have equal access or a leveled playing field, right? That put it in a more lay terms, so that you are able to access the things in the educational environment. And I also try to explain to parents that same document for the 504, which again is a piece that prevents discrimination, is also available for kids that have diabetes, right? I'm sure you've written some of those, signed those off, right? Where they need something a little bit different. It's for also kids that may have other chronic medical conditions that may require some accommodations in their school day. So it's not anything completely different for those groups of kids than it would be for kids with mental health diagnoses. The first thing that I will explain to them, and then if it's more of an impairment for the child in the school day, so an individualized education plan is a little different because it's going to be for children who need more modifications, right? Because maybe the impairment is more significant. And so they need not just accommodations like I just mentioned earlier, for children that are trying to prevent discrimination and they need equal playing field for the environment. These are also children who still need that, but they also need things modified within the curriculum or a day, right? And so that might mean modification to the grade level curriculum. That might mean modification to skills that are taught, right? Because of dysregulation or skills that are lacking. So it's going to be much more explicit teaching and changing of things in order for the child to have a free and appropriate still education for them, as is guaranteed to all children. So that's what looks a little bit different. So I usually will explain to parents like that difference between accommodating, which is, again, making things equal, and then modifying, which means that the child needs some additional support in order to access the curriculum. But again, I think the big piece is just helping them understand that it does not prevent them from having a successful future, right? It does not prevent them from being able to access the curriculum still. I think that no matter what kind of experience you have as a parent, meaning if you have a child with an IEP, 504, or not any of those things, you want to always be an advocate first for your child, right? So there doesn't have to be then that fear behind the 504 and IEP, because you are still going to advocate for your child. Now, I also will say, though, in all fairness, that it can feel like a very intimidating, particularly the IEP process, intimidating, heavy paperwork, cumbersome process to many parents. There's a lot of language that can be used that can sometimes be unfamiliar to parents. And so every team in a school and district is going to be very different with how well they're able to avail themselves to that family to help them understand that specific process for the IEPs. And so that is why I will also share with some families not to be, again, reactive or adversarial, but to be an advocate and be preventative, to use individuals who have knowledge of that process, right? So that may mean for some families, if it's really sticky, it may mean using an advocate for someone else to sit at the table with them. That's a professional in that area and can be that person's checks and balances. It may also just be increasing your awareness as a parent so that you can come to the table feeling capable, right? And I will say this because you have families that listen, and I share this resource a lot. So why not share it here too for your listeners? I recommend, because not all families have the means to pay for an advocate, right? And advocates can be very expensive sometimes. And so that can definitely be a barrier to understanding and navigating that process. So I refer a lot of families to a resource called Your IEP Source. And she is a former school psychologist, former special education teacher, former licensed psychologist, also a woman of color, if that matters to some families. And she has like a $20 a month membership, somewhere around there, $20 to $30 membership. I usually tell parents it's the cost of like maybe a few cups of coffee if you do that, or not taking your kids out even for like not even the healthiest meal, right?
We skip. That's, to be honest with you, it's like that's two people. So,
Yeah.
but that's a great, resource for
Mhm.
parents. I know here we have some other ways of helping some get advocates, and I've had to utilize that resource for some parents because they may not understand.
Yeah.
And the reality is that there are parents who had learning difficulties, right? And then we're asking them to sit in a meeting and understand their child's IEP. And
Absolutely.
so I definitely try to make
Absolutely.
sure that they have advocates. And if you are a grandparent and that you had to do that for your child who's now the parent,
Mhm.
maybe you can also step in and help
Yeah.
or sit in those meetings and things like that because everybody wants the best for their children.
Absolutely.
I hope.
Well, yeah, most people do, yeah.
That's most, right? Most people are wanting that. And so when you allow your child to have all the tools that they need, then you are really helping them to succeed.
You are.
And I know sometimes it can be very scary, things like that. And sometimes we don't trust systems.
Mhm.
However, I tell people all the time if they kick your kid out, it's just, I mean, because they're not going to class or they're failing or they're holding them back, like, why are you trusting that part of the system? And the reality is that behaviors worsen in children who aren't going to school, missing school, and if they're failing school, and if you're 20 as a senior, you're probably not going to class,
Yeah.
and so I think sometimes we forget about those things is that the longer we have them struggle, they may also deal with bullying, right? Because if you
Mhm.
can't read on grade
Absolutely.
level and you're in class, but you don't have a 504, well,
Mhm.
in this case, it would probably be an
Right.
IEP, right? You don't have an IEP, which is going to help modify that education for you, or maybe the teacher's not going to call on you to read in class. And so now your child's being made fun of. Now they're
Mhm.
being bullied.
Mhm.
Now they're, just really wondering, like, am I smart? And the reality is you may have just not, as you said before, you're not learning
Yeah.
because maybe you learn differently. And we
Absolutely.
needed to modify how we teach you to learn.
Yeah.
And that brings up for me, dyslexia testing.
Mhm.
It is so hard to come by.
Yeah. Yeah.
And so I was just curious. This is just my own curiosity is why? Why is it so hard to find people to test for dyslexia?
Well, I think we're a little bit unique here in Atlanta. I don't know if we have the same. It might be a little bit different there,
Mm.
right? We have several dyslexia schools here in Atlanta. Yeah, I always say that we're like a unicorn. Yeah, so
We might lose some people. Let me be no.
yeah, they were probably a little bit of a unicorn here. We have several dyslexia schools. We have a very large dyslexia association here in Atlanta. So I wouldn't say that it's as difficult here to come by, but I think that it is harder. Definitely, I've gauged from my colleagues out in other areas, most areas, right? And I think it comes around like not understanding it, right? So from a school psychologist perspective, many schools outside of Texas, which is also where I'm from, some things there, but for dyslexia, they've been like identifying that as a name in schools for years, right? When I was a student, there was no fear or turning kids away because they came with a label of dyslexia, right? In fact, they have 504s for dyslexia. I mean, you don't have to necessarily have an IEP to modify things. You might just need accommodations, the tools, right, to make things equitable. So there are some states that have been like that for a long time, but many states within the educational eligibility criteria have shied away from dyslexia, right? And I think it comes from a lot of misunderstanding, not really understanding what dyslexia even is in some cases. I think a lot of states have had to clarify what is dyslexia. There's been a lot of legislation that has come forth about clarifying what is dyslexia, how do we treat it, what are the best evidence-based practices around that. And that's all come up in the last decade, right? And some places still not really come up, right? And so then therefore you have providers in the community that then are also shy about assessing dyslexia because the confusion trickle down from the schools or the lack of awareness or the resistance to acknowledging it, right? Because I definitely know in Georgia there was a point, and still a little bit that way, but definitely was a big point when I was a school psychologist. If you came saying the dyslexia, school said, "Oh, we don't acknowledge that." Right? We don't use that name. I think that is, something that impacts how then people evaluate, right? Um, yeah.
That's huge. I wasn't sure because we really struggle with being able to find these resources. And so, I mean, it's great to hear that there are certain states that are championing this because I see so many, I won't say so many. I see too many for me patients who I'm not really able to help them find a diagnosis unless they can pay cash, but
Mhm.
actually utilizing their insurance to get the diagnosis is
Well,
very difficult.
that is still problematic, even here in Georgia, right? And I think that comes down to an insurance issue, right? That's bigger than just
We'll be here all night.
yeah. So
Ugh.
yeah, that comes down to like that there is a clause in insurances that they do not cover anything that's related for educational purposes. You could bill it if you want it. That's not then going to be that'd be considered fraudulent, right?
Right, but
And
only realize that
yeah,
you not succeeding educationally can lead to so many other
yeah.
things that you would
Well,
pay
the
for,
insurance
right?
will say, that that's you can go back to the schools and get it done, right? And of course, the schools will say we don't get the name dyslexia, so it's kind of like a ping pong experience, right?
Yes,
And
and I'm losing this game.
yeah, there's no winning the game because the schools don't give the name. That is still true here in Georgia as well. They don't give the name still, right? They will acknowledge it if, at least if you come and say like, okay, we can acknowledge that you have dyslexia. You might see it written in the eligibility, like that it came from a private psychologist. You wouldn't have seen that before, but they are not going to call it dyslexia in the schools either because that's still not in the legislation to be in the criteria, right? So that's one thing. And then, like I said, the insurance is going to say it's educationally related. So the schools can cover that. So, yeah. So it still comes down to a situation of you don't have much access if you're relying on your insurance because it is a self pay kind of diagnosis still.
Mhm.
That's in Georgia too. So that is probably why you
It's
find
universal, right?
as universal. Yeah.
Yes, just kind of wrapping things up. I want to, thank you so much for
Yeah.
coming on and sharing so much information and hopefully encouragement for families. But any last few words that you would love to share with the audience?
Yeah, absolutely. I mean, I just want anyone that is listening to, again, kind of reiterating that last piece of that we are all advocates for our children, right? And so when I first started off our conversation, I talked about my idea of resilience is about children thriving. My also piece for parents is that trust yourself and advocate for your children, regardless of what setting they're in, whether it is a public school, whether it is private school, whether it is homeschool, whether it is, any other type of non-traditional setting. We are always the first line of advocates for our kids, educationally, and then emotionally and behaviorally. And so you don't have to have all the knowledge of a pediatrician. You don't have to have all the knowledge as a psychologist to know your child, right? And that is why there isn't the need to wait on concerns because you know your child. And if it turns out that what you felt like you knew was not diagnostic or a significant impairment, there was no loss in that because you are always the first one to advocate. And I also will say is that sometimes, even if there's nothing found, you still continue to monitor and watch and advocate because we are people as providers too. And so sometimes, things are either missed or sometimes concerns aren't really as, much of a red flag yet, but it could become one. And so I've seen many parents turn away from their concern because the provider, who was an expert, said, not a problem. And the parent then said, well, I don't have to think about this anymore, even though they saw continuing behaviors or problems.
No, that's huge, and I really appreciate you reminding us that
Mhm.
because parents have to be the biggest advocates, and hopefully we are all open to hearing those concerns from parents and making sure that, even if we reassure you, we remind you,
Yeah,
just as you said, that we are all here for our children, and if we're not behind them, then who is?
who is?
And we have to be their biggest cheerleaders for
Mhm.
their whole lives, right?
Yeah,
It's
absolutely.
the, it's kind of what we're entrusted to be as a cheerleader.
Mhm.
So thank you so much, Dr. Dixon. If you're, in Atlanta, she if you can get her, it's hard to get her because she does very few evaluations, but she's great at what she does. I'm trying to get her in Oklahoma to get this double, credentialing, but she's ignoring. No, I'm just kidding.
I love
I'm
it.
messing around. But yeah, but we need experts like you and continue the great work. And I hope that all of you parents who are listening feel energized and you're ready to advocate for your children and you're not afraid to ask any questions.
Absolutely.
Have a wonderful day. And thank you so much for tuning in to Raising Resilient Minds.